everyone. Thanks for coming to the Senior Services Alliance breakfast. We have Bonnie Danker today, who is a certified senior advisor and certified dementia expert from CarePatrol. Bonnie considers her ultimate calling to be helping seniors and their families navigate the challenging process of finding the best possible senior living options. She listens carefully to all of her clients' needs, concerns, and preferences before recommending appropriate levels of care, such as independent living, assisted senior housing, memory care, or in-home care. And I'm actually going to share her PowerPoint.
We're getting really technical.
Yeah. All right.
Looking good. Good to go?
Yeah, I think so.
Thanks. Good morning, good morning. Happy Wednesday. It's great to be with many of you, colleagues and friends. It's really been a ride, hasn't it? If you're someone in the audience that's been a caregiver recently, raise your hand. Anybody in the audience been a recipient of care? Keep your hand up. An advocate, a volunteer, helping out those in the community. As you look around the room, most of us have our hands up. I think what it points to more than anything is during COVID, but also in other times, that we really need one another. But what it's really pointed to me is how much we are a community of providers, caregivers, care recipients. And I find I'm empowered and inspired by many of my colleagues. And I look forward to continuing to work together and to brainstorm and to really pull together as a senior serving organizations to help support our seniors and their families in the community. So I applaud you, and I think we're working really hard, and I appreciate everything you're doing out there. So please reach out to me at any time, and I'd like to have that same engagement with you as well to collaborate. This also brings me to what kind of drew me to get into this work. About 12 years ago, my dad, Joe, had Parkinson's and Alzheimer's related dementia. And during that time, I was an advocate and a caregiver for him. And we were looking for resources and help. My dad was also a veteran. And I reached out to many different communities, services, and I learned of a company called CarePatrol that provides education and support and advocacy for older adults, and the consultations at no charge. And I was so inspired by what they were able to help us with, that as a legacy to my dad, when the franchise area in the Washington Metro was available, I opened up my company in this area. So it's a passion for me as well, as I know it is for many of you. Today, we're going to take a little deeper dive into navigating transitions for your loved one's care and how does that work. And I'm going to be touching upon some different types of care and housing. And I would welcome any of you in the audience, any of my colleagues, that if you have something that's insightful or helpful, to please unmute yourself and add that information in. I think the fact that this is being recorded will be extremely helpful. We certainly can share that link with families or with other colleagues who might need some of those resources to kind of put in their toolbox as well. So let's take a look at our objectives for today. Understanding the range of senior living options, how memory care differs from other senior care options, assisted living cost and regulations, and we'll just touch upon some information and a handout at the end on private and veterans and other government programs. So why the need for senior housing? Well, the population, we've all been hearing about this, of the age 65 plus is surging. And by the year 2030, it's estimated that 65% of our population will be in that cohort group. That's astounding. We're seeing a tremendous increase in life expectancy. And this creates a significant demand for senior care and senior housing. The baby boomers hold 70% of the financial assets and 50% of the disposable income. So the opportunity is there. Let's take a look at the types of senior housing. We're just going to look at the 5 major types. What we're going to focus on is independent living, nursing homes, which are now retitled as wellness centers, continuing care retirement communities, assisted living, and aging in place. Many of you focus your work in one of these areas, or it may be multiple areas. Well, let's start off by taking a look at independent living. Independent living has taken on many new, I would say, flavors. You have continuing care retirement communities, also known as life plan communities. There's 38 of this type of community in Maryland, and I believe there's 3 that are being built now as we meet. This type of community offers endless opportunities for adults to remain active and engaged. Usually with an independent continuing care retirement community, you're going to have some type of usually there's 3 different types of contracts. But at the front end, you're buying in, and most of the time you're coming in at that independent level. Although there are some communities now that are allowing people to enter in at that assisted living or skilled nursing level. But usually with a continuing care retirement community, it's really meant to be, the focus is really at entering in at that independent level, while you still can enjoy and take part in many of the amenities and the services and everything that the campus has to offer. They come in a wide variety of different sizes, cater to different cultural and ethnic groups. In the Washington metropolitan area, we have a variety of these kinds of communities that are available to us. So usually you have that buy-in on the front end, and then you have a monthly fee. And your monthly fee might range from, for a single person living in an independent living in a continuing care retirement community, might be $3,500 a month. And that would give them the amenities of the community, as well as usually 1 meal a day, or kind of like what colleges do, where you have a pass for so much money that you can use in the restaurants on that campus. For a couple, it might be start off in the neighborhood of about $8,000 a month for a couple living in independent living, part of an assisted living. So some of the advantages of this kind of community style living is that you've already planned ahead for your future care needs. No matter what level of care you might need at any time in your life, you have those options available to you on that same campus. There's really not the worry that if you run out of money, because part of the commitment from these communities is that we'll care for you for life no matter what level of care you might need. So you're guaranteed that lifelong shelter and care. Some of the cons or some of the disadvantages people might mention or talk about is that you're putting all your eggs in one basket. Many times an older adult is selling their primary residence in order to have that entrance fee to get in the door. In order to go into a continuing care retirement community, you're going to have to qualify both financially and medically. There is usually a healthcare assessment done as well as part of your entry. And they're really looking for, ideally, a candidate who has financial resources, as well as someone who's at this point able to function independently. It can be hard to get your money back if consumer interest changes. Right now, consumer interest is high, but depending on the area of the country you live in, that could be a consideration. Other levels of care may not be available when you need them. What we're seeing in this area is that many continuing care retirement communities they might have been 85% of their units may have been independent living, and as people come of age, they may not have had the same amount of opportunity to transition into their assisted living. So what we're seeing is that many of the continuing care retirement communities are now building out. They're building out their assisted living. They're adding memory care within their campus. So that's something that's relatively new, and they're addressing the needs of their clients or their residents in order to meet their needs. Another type of independent living would be your 55 or 62 plus rental housing. And there's 278 of this kind of independent living throughout the state. Usually this is a 1-year rental tenant lease agreement. You can see from the pictures, again, a wide variety, from maybe an apartment community that might have 20 different apartments to those that are in the neighborhood of 700-800. The advantage of this kind of living is that it's affordable. It's an easy out contract. Usually for health reasons, it's a 90-day out contract. Otherwise, it's usually a yearly lease. They're handicap accessible. Many of them have been refurbished in the last 10 years in order to keep themselves competitive in the environment. And for someone, you don't have any home maintenance. Many of them have activities, programming, and a very much of a community feel. Community health clubs and community centers on site. The cons is that they don't offer healthcare services or meals. However, what we're seeing in much of this 62 plus independent living is that many of them are contracting or partnering with some private duty agencies, so that someone who's living independently but might need some support or service is able to take advantage of that by contracting with an agency in order to help provide that service. So we're seeing, again, in all areas of senior housing, organizations really taking a look at how can we best serve our residents and keep them here and keep them safe and well supported. Does anyone have any work in the 62 plus independent housing area and have anything that they'd like to add to that? Okay, we'll go on to the next. Let's take a look at assisted living. Assisted living is really your largest type of senior housing other than living at home at this time. There's over 1,100 assisted living communities in Maryland. What's interesting about Maryland, different from many other areas across the country, in addition to the bright views, the Sunrise, Brookdales, the communities that many of us are familiar with, there's also hundreds and hundreds of residential assisted livings throughout the Washington metropolitan area. In fact, more than 60% aggregately are residential assisted livings. So this is something that's unique to this area. As a owner of CarePatrol, I know many of my franchises across the country don't have this option available for families, and it can serve the needs of different individuals based on their clinical needs and the socialization opportunities they're looking for. But there's over 1,100 throughout the state. This type of community allows people to be as independent as possible while supporting them with their activities of daily living, such as, I think most of us are familiar with what activities of daily living in, so I'm not going to beat that. The communities vary greatly in size. Residential assisted living is what would be considered anything up to 16 residents living on site. Commercial assisted living would be 17 and up. So in the greater Washington metropolitan area, I mean, I work with communities that are everything from a townhouse to a mega mansion. It's amazing what's out there. Similarly, with many of your commercial communities, some of them are really offering both a public and a private now, where restaurants and beauty salons are open to the public as well as to the residents of that community. So they're really starting to merge those worlds together. All assisted living communities, by nature of their regulations, offer 3 meals a day, assistance with activities of daily living, and many of them meet the requirements of, Joe Sperling can probably speak to this a little more, but many of them meet the requirements of your long-term care insurance policies. So certainly important to look at that when you're looking at which communities, whether it be assisted living or continuing care retirement community, really look at that long-term care policy, understand that criteria, and understand the staffing and the requirements from the other side of it, from the assisted living or the assisted type of community care or private duty care. The cons is that Medicare does not cover the cost of assisted living. And I'd say probably 10 calls a day are folks who are under the impression that Medicare will cover the cost of assisted living. Do many of you experience that in your work as well? Where they think it's going to cover the cost of your private duty caregiver or other support services. So this is certainly a big area that as an organization we could certainly work to help educate people a little bit better in that regard.
Bonnie, Ellen has a comment.
Yes.
Yeah. Hi, Bonnie. I'm also familiar with long-term care insurance. Medicare doesn't pay for assisted living, and it doesn't pay for nursing home custodial care either. So
Yes.
that, and some of the earlier long-term care policies, some of the older ones did not specifically list coverage for assisted living because assisted living didn't exist at the time.
That's a good point. I've had that come up a couple of times with some of my 90-year-old clients.
Right. They were pioneers to buy the insurance, and unfortunately, ways to care for people changed.
Yes, yes, yes. Also with assisted living, there's not really a set standard for accommodations. So that's an area that can sometimes, when you're trying to compare and contrast, it's more difficult in that regard. They're regulated by the Department of Healthcare Quality, and each state is different. So whereas in Maryland, we may be able to care for somebody who's a two-person assist, for example, in an assisted living. In other states, that type of assistance may have to be done in a nursing home. So again, there are differentials. The Department of Healthcare Quality is the organization that licenses assisted livings as well as surveys assisted livings. So if you're wanting to have an understanding as to the safety of an assisted living, that is public information, and every community does have to share that with you if asked. The average cost, just to put this all in perspective, a national average for assisted living is $4,200 a month. Now, in this area, our real estate's higher, and therefore our relative costs are going to be higher. In this area, regionally, the average cost for a commercial community usually is going to start at about $6,000 a month. And for a residential community, you're usually in the neighborhood of about $3,200 and up a month. Baltimore will be a little bit less, but that's going to give you just some ballpark idea. Many assisted livings residents do also, if they qualify, apply for the Veterans Aid and Attendance Pension. That pension can help pay for care for assisted living as well as private duty care many times. Also, there are a subset of residential assisted livings that participate in something called the Group Home Subsidy Program. And these programs are outlined a little bit more in detail in a handout at the end. But it's a subsidy program for individuals who kind of are above the Medicaid line, but below what I would consider the average income level. And then there's also some residential assisted livings that participate in something called the Medicaid waiver program. So if you have someone that you know that's on the list that qualifies for that waiver program, we can possibly help them find an appropriate living situation. And then within the umbrella of assisted living, there's also memory care. Memory care is assisted living that can come in two different types. It can come as a neighborhood within a continuing care retirement community or within a commercial community. Or there are also some memory care specific communities, such as like an Arden Courts, for example, or a Summerford Place. And there's others like that throughout the metropolitan area. It's specialized for people with dementia, not only in the way that staff is trained, but also in the layout of the community or the footprint of the community, really based on what's known as like an Eden model, with light, with open space, very important things to really help somebody with dementia have the best quality of their day. The advantage is in the memory care, you're going to have usually higher staffing levels. So when you look at the uniform disclosure statement for a community that really compares and contrasts what services are available, you're usually going to see that in a memory care neighborhood or a memory care community, you're going to have more staff to resident ratio, which in hopefully will allow for more supported care for that resident. In addition, the con for that higher level of staffing, you're usually going to see a little higher price point. I'd say usually about an average of about $1,000 and up more a month for a memory care specific neighborhood or memory care community. Then we're going to just touch upon some of the others. We talked about the different types of senior housing, nursing homes, also known as wellness centers. These are facilities that provide both temporary rehab. Many of us have families and individuals who are going in at post-hospitalization in for a rehab stay, as well as permanent residence for individuals who are too sick or too frail to be at home. These provide a higher level of medical care. A nurse has to always be on premises for a skilled nursing center or a nursing home. It's under the direction of a medical doctor, whereas assisted living is under the direction of a delegating nurse, which is usually an RN. The average national cost for nursing home care, if you're paying out of your pocket, is $9,000 a month. In this area, it's about $14,500, I believe. If there's anybody that's in a nursing home or works with a nursing home, please feel free to share what the cost would be at your community if you're in the audience, to give us a reference here. The pros are that they manage all levels of care. So no matter what your care level, that's going to be a community or a facility that's going to be able to support you. Most nursing homes in the Washington metropolitan area accept Medicaid. And Medicaid is actually the primary payer source for more than 60% of the cost of assisted living. And also, nursing homes. Also, nursing homes have on-site therapy services because they're also a rehab. Usually you have your short-term rehab and then you have your long-term care, all under the housing of that nursing facility. The cons may be the rooms may not be private. We've certainly seen with COVID situations where there are multiple people living in a room, higher level of infection and things like that can happen. Sometimes there's limited on-site activities and programming. And at this time, many people are really quarantined to their room. And many times there's limited access to leave the facility, both pre-COVID and post-COVID, because of the regulations or if they're being cared for under a government program, so to speak. So nursing homes certainly have their challenges, and they certainly have their place in the market because there are many folks who really need that level of service and that level of care that nursing homes provide. Home care. So when surveyed, 9 out of 10 people will tell you, I want to be at home. I want to live at home. And so I'm sure many of you in the audience who work with individuals in their home will attest to the fact that they're holding on to that independence. They're holding on to that ability to kind of have control over their living and their care situation. Home care.
So,
go ahead.
so true, so true.
Yes, yes. Fighting for it. Home care can be supportive, like companion, custodial type of care, and or medically prescribed care for individuals living in independent situations. Large and diverse field. I would say probably 2/3 of us in the audience are involved in this type of supportive care in one way or another. Raise your hand if you're involved in companion home health or skilled nursing. Yeah, so a good amount of us, and that's because it's needed, and that's where the majority of people want to be. If you have any additional pros or cons, feel free to jump in. This was just a short list. The advantage is people have the flexibility to change that care. They can remain in the comfort of their own home. The services are personalized to them. There's not a one size fits all. Their care can be many times covered under their long-term care policy. And the supply of care and support exceeds the demand sometimes. So you're going to be able to get the type of care that you need in the home setting. The cons is the cost can vary widely. And sometimes, depending on where that individual lives, their accessibility to physicians and other medical centers.
Bonnie,
Yes.
one additional con may be that it may require extensive modification of the home in order to accommodate.
You're absolutely right, Joe. Thank you. Let's add that. Any other tips someone might want to add to share with their colleagues or their peers?
No.
Bonnie, I think probably less so in Maryland and perhaps more so in Virginia with home care companies. There's less standardization than there are in other elements of senior living, in my opinion. You know, pretty much anybody can start a home care company.
Really?
And sometimes what that means is you have large reputable outfits or smaller family-owned, very reputable outfits competing against somebody who drives an Uber during the day. And so one has to be, in my opinion, really, really careful in you know, how they vet who they're going to work with. Does that make sense?
Yes.
Yeah.
Yep.
Thank you. I didn't realize that. And then we have, how do you pay for care? The age-old question. So paying for care, this is by no means all-inclusive, but paying for care. We talked about senior assisted living group home subsidy. It's a county-by-county program funded by the county and the state. There's the details. The Medicaid waiver program. A number of home care agencies participate in Medicaid reimbursement. Long-term care insurance. Some folks work with a reverse mortgage. There's veterans benefits. There's also things that folks are doing now where they're liquidating excess insurance policies. And I'm sure some financial people in the audience might be able to share some other ways that people are, creative ways that they're finding monies or assets to pay for care. Anyone have anything else they want to add here?
I'll chime in. Joe and I are both big proponents of long-term care insurance. Not everybody can afford it. It's not appropriate in every situation. And some people prefer to self-insure. And I like to remind people that's fine, but you should earmark which part of your retirement savings is going to be used for your care.
Ellen, as a corollary to what you just said, the attitude that I take is that something is better than nothing. And it's better to plan and have some, even if it's a modest amount of coverage, you're protecting your other assets by putting some coverage in place. It doesn't have to be the Cadillac plan.
Right, I agree with you, Joe, but there's some people who can't afford even a basic plan. And you,
They're more likely to qualify for Medicaid. If that
right. So that's why they don't, right. Okay.
By the way, Bonnie, this particular slide is extremely valuable. And I believe there was a request put in the chat if this slide could be made available to all of us.
Absolutely. I'll send it over to Erin today.
That'll be
All right. So,
May I ask a question?
sure.
Good morning, everybody. This is Mado Ngoya from Joint Hands Assisted Living, and thank you very much, Bonnie, for the information you give us. I would like to ask if you can send us this information of financing so we can have it written down, like this, the waiver, Medicaid waiver, the Department of Aging, how they support families and communities, all these financing. If you can give us this written down so we can go over it and again and maybe share with, no, not maybe, but share it with the family.
Yes, we will be happy to do that, Mado. Erin is the coordinator, and I'll send it to her, and she'll send it out to everyone who registered for today's event.
Thank you.
Bonnie.
Yes, you're welcome. My pleasure. Yeah, we created this as a result of talking to case managers and social workers and saying, what are some of the questions that you get a lot that you'd really prefer not to have to answer 10 times a day? And this is a result of that. So,
Hey, Bonnie,
yes.
can you share with everybody in a brief way about aid in attendance? I think it's the best kept secret in the world.
It is the best kept secret in the world. Do we have any attorneys that do this aid in attendance in the audience today? I don't want to take it away from them if we do. Okay, so Veterans Aid in Attendance Program is it's a medical pension that someone qualifies for, not by years of service, but by having been a veteran during a wartime period and had a satisfactory type of discharge. It's for the veteran and or their spouse. You have to be 65 years or older to receive it. There have been some recent changes in the program itself back in, I think it was 2019. But it's for the veteran and or their spouse. And if whether their spouse is alive or has passed, the veteran is alive or has passed, still eligible for that. It usually takes I usually recommend to my families that they work with a professional who does this type of application, because it is a cumbersome application. But when done correctly, it can make all the difference in the world for many people. For the spouse of a veteran, it's usually up to about $1,100 a month. For the veteran themselves, it's usually up to about $2,100 a month. 2 activities of daily living, not that hard to prove. And usually from application to approval, it usually takes an average of about 4.5 to 5 months, but it is retroactive to the first of the month once that application was submitted and considered a complete application. There are a number of elder care attorneys in the Washington metropolitan area who do this kind of, one of the services that they provide. I provided an organization that we've used in the past. It's been so impactful. We've probably, in the 10 years or so I've been working with this program, had over about 180 vets or spouses get this benefit. And I can tell you, it really makes a tremendous difference for them to be able to continue to afford the type of care that they need. And for the family, many times, not to have to reach into their own pocket to help support their loved one. So that's my soapbox for the day. Thanks for the opportunity.
Thank you so much.
You're welcome. Thanks for the opportunity to meet with you. Happy Thanksgiving.
Thank you,
And I look
Bonnie.
forward to.
Them to you.
Thank you.
So at this time, we are going to have everyone introduce themselves. So we're going to start with, along the top of my screen, we're going to start with Tony.
Hi, everybody.
Hi,
I'm
Tony.
Tony Breda. I know most of you, but not all of you, so I'm going to rectify that as quickly as I can. First of all, that was an awesome presentation, Bonnie. Thank you so much. I work for a company, actually own a company called A Family Tie. We help families find assisted living, memory care, and independent living, home care in Maryland, DC, and the northern half of Virginia. And I've been doing that for about 4 years. I worked for 20 some odd years in assisted living and nursing homes in Montgomery County and Baltimore County, Maryland. And I'll put my contact information up on the chat. Thank you.
Jeff O'Neill. Jeff.
Hey, sorry about that.
There we
I was
go.
on mute. Hey, Jeb Byrne from Barefoot Ventures. So our company is a disinfection company, and the same electrostatic technology and chemical that we used over in the healthcare space when we were doing the post-operation disinfection turnover in an operating room and surgery centers. We've taken that over to the commercial space as people have realized it's more important to kill what you can't see rather than that potato chip that you can see. So how we've worked with the senior living and that whole space is that, groups have had us come in there and disinfect the core factor common areas of and amenity spaces of the facilities. We've gone into the resident rooms, while that 97-year-old resident is inside of the room. We've worked with home care companies to where when they've gone to a new client's home before they start the service, our team has gone in there and disinfected the facility. So because our product has a 60-second kill claim against norovirus and coronavirus and a neutral-based pH level, and the technology we use is the same technology that now Marriott Hotels and Delta Airlines are now trying to use. So that's how we've been working with senior living, kind of the whole senior living space in general, and I'll put my contact information in the side chat as well. Thanks.
Terrific. Let's go to Mr. Marshall. Tariq Marshall, there you are.
Yes, good morning, good morning, good morning. Hi, I'm Tariq Marshall from Oasis Senior Advisor. We have a pretty good representation of the senior advisors in this room. But Tracy, my partner Tracy Skolitsky, and I run Oasis Senior Advisors, and we work out of Montgomery County.
Excellent. Jeff O'Neill.
Good morning, Sabrina.
Good morning, Jeff.
Jeff O'Neill, partner at New York Life. I lead a financial team of agents and advisors. So I am hiring, looking for sharp, hardworking people with a heart for helping others and an entrepreneurial spirit to join my team. We focus on financial planning and tax-free growth solutions. So if you like to pay a lot in taxes, we're not the right team for you.
Excellent. Katie?
Good morning. How are you?
Hi.
I am Katie Ostrowski with the Rockville Real Estate Exchange. We are a hyper-local brokerage that focuses in Rockville. We can sell anywhere in Maryland or Montgomery County. We've chosen to focus in Rockville just because there's so much opportunity here. And actually, it's a very senior-friendly community. And I recently received my seniors real estate specialist. So this is something close to my heart. Thank you, guys.
Hey, Katie. Andrew?
Good morning, everybody. I know I'm familiar with a lot of you here. I'm Andrew Klansik. I'm one of the new directors of community relations at the new Brandywine Living in Potomac that is opening up for resident move-in probably February, March. Our sales center is open today, which has a studio model in it and a one-bedroom model in it. So we book tours for our leads and our professionals. So anyone that wants to book a tour to come see what the Brandywine community is going to look like, I'm more than happy to do that. I'll put my information in the chat as well. But I'm excited to be back in Montgomery County, and it's great to see all of you.
Excellent. Hey, what street are you on? Where are you located?
So we are on Potomac Tennis Lane. So right behind
right, okay.
the
Next
Danker.
to the next, there's a nursing facility right next door.
Right, it's Manor Care Potomac. And so we
Yes.
look out over, for any of you golfers, we look out over the 10th tee of Falls Road Golf Course.
Yes, and you're across from Bullis.
Yes, yeah.
Got it. Okay, Joe Sperling.
Hello, everybody. Good morning. I'm Joe Sperling. I'm an independent insurance broker, and I help folks get long-term care coverage, as well as life insurance, disability income protection, and annuities. And simple answer to simple suggestion to everyone is to plan ahead, be prepared, don't be surprised. Stuff happens. I'm Joe Sperling. But I'm
But not your average Joe.
There's an echo in here.
Jamie.
Hi, everyone. Thank you, Bonnie. Great presentation. I'm Jamie with Capital City Nurses, and I'm a home care specialist. You said hey? Oh. Yeah, so we've been providing private in-home care for 45 years to DC, Montgomery County, and surrounding areas. And we're providing the skilled services as well as home health aides and companions. So I look forward to connecting with people I don't know.
Nice. Gary, hi. It's her first meeting. Hi.
Hey, thank you, Sabrina.
Yes, you're welcome.
Hi, my name is Gauri Chande. I'm a new franchise owner with Home Watch Caregivers. And when I say new, I mean brand new, as in the pre-launch stage. And planning to launch soon, hopefully in the new year's, awaiting state approval now. I'm really excited to be here. We will be providing companion care and some skilled nursing home care, in-home care for seniors in Montgomery County. And HomeWatch has really high brand standards for vetting and hiring their caregivers. But I think what really drew me to HomeWatch was how person-directed their whole approach to care is. And I can really attest to that because I have also come into this business, like many of you, after being a primary caregiver for my mother-in-law who was still suffering from early onset dementia. So kind of know how navigating the whole journey looks like. So I'm really excited to connect with all of you. I see some familiar faces, some new faces, and it's great to be here. Thank you. I'll leave my information in the chat. Thanks.
Thanks. Tony?
Hi,
There
good
you go.
morning, everyone. For those who I haven't met yet, my name is Tony Hughes. I'm new to the Corewood Care team about 2 months ago. So if you're not familiar with Corewood, we do the home care as well as the care management services. And we just brought on board Amy Koppa, it's her first meeting today.
Nice. And we're going to move on to Sharon.
Hi there. I was invited by Meryl this morning, so thank you, Meryl, for inviting me. She knows me as a video producer, and I've been working with businesses for over 20 years, but of interest to this particular community is the fact that I've been streaming funeral services over the past 8 months. So I'm using that web streaming experience and applying it to where our current need is, and doing that for under $500. It's not a hard job for me with my professional gear. But if anyone wants to use video in their own business marketing purposes, I'm happy to answer any questions about that and what's involved, do case studies for you, testimonials, etc. Thank you very much again, Meryl, for inviting me here. And I'm really happy to meet all of you. This is great knowledge personally as well, because I have aging parents as well with their own challenges. So thank you.
Thank you, Sharon. Daya?
Hey, good morning. Good morning. Thank you again for inviting me. Sabrina invited me, Meryl invited me, and Joe Sperling invited me. So I'm happy to be beaming in this morning and also getting that really good information. I did take lots of notes. So
Where are you?
I am in Alabama right now.
Wow.
Yes. So my office is still in DC, and that's still my major client base. But I just recently picked up some clients up in Albany, New York. It's very interesting. So I'm like, okay, sure, whatever. Life on Zoom. I'm a professional coach. I do specialize with working with lawyers and law firms on growing their business, pivoting. Some lawyers think they're going to age in place or whatever, but they really ought to look at succession planning of their law firm. They've built something, they've created a legacy. And so I do a lot of what I call partnership marital counseling within law firms so that can be healthy to transition. And I'm also a certified mediator. So if there is a dispute between folks on things, I'm happy to come in and assist to stay out of court, if you could even get into court these days where you're at. So I'd love to have a one-to-one with everybody, and thank you for inviting me.
Thanks. So nice to see you. Ellen?
Good morning, everybody. I'm Ellen Tillman. I have an insurance and financial firm just celebrating 25 years in business. Some of the things that we do relevant to this area, long-term care insurance, setting up an income that you can't outlive, because if you don't have insurance or need to supplement it, you need ways to pay for this care. And I work in the areas of planning for income, insurance, legacy, retirement, as well as employee benefits. And Daya, I would love to talk to you because succession planning is part of our practice. And I'd also like to say what Jeff O'Neill was talking about before. I could be one of those people. 25 years ago, I met somebody and became a New York Life agent. So it's a great career. And if you know anyone looking for a job, it's a great career and it's a wonderful company. So keep that in mind. And I hope everybody has a happy and healthy Thanksgiving. Thanks.
Thank you, Ellen. Let's hear from Steve Long.
Hi, I'm Steve Lon. I'm with Advanced Nursing and Home Support. We are the long-established local expert at meeting every need. We've been family-owned for 27 years. So we've been doing it a long time, and we provide the entire continuum of care. So that's everything from a simple companion all the way out to an RN. And we can do that anywhere, including in your home, at a community. We also provide staffing. So if you're working in a community, and especially during COVID, and you have call outs, you can call me. We can set up an agreement. And then if in the instance that you do have a staff calling out, you can give us a call to try and supplement that. And we do also provide COVID care. So we have a COVID team as well. Wearing full PPE and following all the procedures laid out by the CDC. Again, Steve Lon with Advanced Nursing and Home Support.
Thank you, Steve. Let's move over to Kat.
That's me. Hi,
That's
everybody. It's like I'm waiting for my turn. And it's like, you know, it's my first time here in virtual. So, but, you know, I've been in the, you know, whenever we did the in person. But good morning, everybody. My name is Kat Villanueva. I'm a registered nurse and founder of Nest and Care. We are in private duty in-home care. And so I know there's a lot of home care agencies and everybody has their own specialty. For Nest and Care, our specialty is neurological disorders. So I'm certified in stroke and neurological disorders, and so that's really the focus of the model of our business is focusing and caring for people in the home that have, you know, stroke or Parkinson's. In fact, I do have a webinar at 12 noon today recognizing stroke. So I will send out sort of like the invitation for a 30-minute webinar with knowledgeable aging. Really important to just learn about, you know, recognition of stroke. If you can teach your children, teach your grandchildren that are staying home with, you know, parents and grandparents, that's really, I think, very important. Thank you.
Thank you, Kat. Let's move on to Gina.
Hi, I'm Gina. I'm a community sales counselor in Seabury at Springvale Terrace. I don't know any of you, but it's nice meeting you. It was a beautiful presentation too. I've learned a lot. I've known a little bit from it, but I learned a lot.
That's awesome. Well, please continue to join us.
Yeah. How often do you do this meeting?
Typically, it's once a month, but I think we're going to be skipping. We're going to be skipping December. And then we'll have a meeting in January, and then also an educational event also in January. And I'll be sending. Awesome. I'll send out.
Yeah,
and I'll send out a meeting notices for those. And hope you can join us.
Thank you. I appreciate it.
Yes, sure.
Definitely.
Yeah, Madhu.
Good morning, everybody. Nice to see you all and to hear from Bonnie. It's really very good presentation, as Adi have said. We are residential assisted living. We receive people from those who are independent to the one in the hospice. And we have chosen the art of caring, and we do it with passion. If you know somebody who need a place to live, a very good place to live, where they will be treated with dignity, just bring them in. We have 3 more beds left. So if you have time, we can chat and do a virtual tour so you can see our place. So you all stay blessed and stay safe.
Thank you. It was so nice to see you.
Nice
Happy
to see you,
Thanksgiving,
Sabrina.
Madhu. Yes. Melissa.
Good morning. Great to see some new friends, old friends, great colleagues. This is beautiful. My name is Melissa Koppel, and I am the liaison for Community Angels Nursing Services. We have been in business for 5 years, and we are family owned and operated by 2 wonderful registered nurses. We provide skilled as well as non-skilled home care services. Our prices are affordable, and one great fact about Community Angels Nursing Services is we accept Medicaid waiver. So we can help those who can afford us, and we can help those who are under the Medicaid waiver program. We also provide staffing. So we have been helping a lot of communities through their time, through this pandemic. And we all know the next phase is here. So I hope that everyone stays safe. Please do all that you can to do your part to stay safe, and happy Thanksgiving to all.
Thank you.
Thank
Now
you.
we'll move to Leslie. Leslie, there you are. Okay.
Here I am. Good morning. I'm sorry my video is not coming up today. Certainly would have to look at that. It's nice to see everyone. Know some of you, but meeting some of you for the first time. So I do love that. Was a very inspiring, informative presentation that was given by Bonnie. And I love the idea that the information provided is going to be posted so that we can use it, we can read over again, and be able to digest all that has been said today. Again, my name is Leslie Brown. I am the owner of New Life Assisted Living located in Silver Spring. This is a residential assisted living service we provide for this in the Silver Spring area. So this is where we take care, we provide excellent care for our seniors who are unable to stay at home rather than going to the larger facilities. Some individuals would like to come to the smaller facilities, which is more intimate, and as a result, we are able to provide the care that's needed, the one-on-one that's needed in the private setting. So that's what we do in Silver Spring. And we love doing what we do, and always think about New Life. If there's a need for someone to be placed in residential assisted living. And nice meeting you all. Stay safe, especially in these times. Stay safe and happy Thanksgiving.
Happy Thanksgiving.
Happy Thanksgiving.
Let's go on to Erin.
I'm Erin, the Director of Griswold Home Care of Bethesda. I think I'm rounding out the home care private duty. We provide standing in Montgomery County to those who need it and wherever they call home. And I